Hello, my name is Dr. Katsuura, and I'm a board-certified orthopedic spine surgeon practicing in Northern California. Today I wanted to talk about another very common problem that I see in my spine clinic, which is neck pain. Neck pain, just like back pain, is very common. It happens to almost 50% of people at some point in their life. Part of the reason why neck pain is so common is because the neck is very mobile. It allows you to look around, look over your shoulders, look up and down, and so it's a complex machine. It can break down. As spine surgeons, we call the neck the cervical spine. That's just the anatomic name for it. And we think about it in terms of its components. There are 7 cervical vertebrae. They are numbered C1 through C7. And just like the low back, there are muscles and ligaments that hold the bones together. And there are nerves that exit the cervical spine. But there's one big difference between the low back and the cervical spine, which is that the cervical spine contains the spinal cord. As we will see, the cervical spine is also designed to allow a very high degree of motion. Here in this cartoon you can see that there is flexion and extension, and the neck also bends to allow rotation from side to side. Let's take a look at the individual components of the cervical spine. Here you can see the 7 cervical vertebrae. They're each separated by a small intervertebral disc. In the back of the spine, each successive vertebrae is connected by small facet joints, also known as zygaphyseal joints. Starting at the top of the spine, each bone is given a numeric number, starting with C1 and moving down to C7. The discs are numbered according to which bones they are between, so for example, the C23 disc is between the C2 and C3 vertebra. The top 2 cervical vertebrae are very anatomically unique, and they're named the atlas and the axis. The atlas rotates on top of the axis, providing the majority of rotation in your neck. The bones of the cervical spine protect the nerves that exit from the spinal cord and travel to your upper extremities. Looking at this from the back of the neck, it almost looks like a tree, and similarly from the side you can see the nerves exiting from the spinal cord. The neck also has a very elaborate series of small muscles connecting each vertebrae that allow very high degrees of motion. Having this basic anatomic understanding will help us conceptualize the various issues that can go wrong in the cervical spine. Today we're going to be talking about the heavy hitters, the things that are most common in my spinal clinic. Some of the common problems that I see are things like cervical disc herniations, cervical stenosis, compression of the spinal cord, which is otherwise known as cervical myelopathy, degeneration, and arthritis. Now, these conditions range from the very serious to more benign, but they all have one thing in common, which is that they can all cause pain. I think for most people, neck pain is inherently more scary than pain you may experience in other areas of your body. And that makes sense. The neck is obviously a very vital structure. It contains a lot of very important organ systems, and anything that goes wrong in there is probably not good. But that having been said, remember, neck pain is very common, so don't panic. Just go see a physician and get evaluated. Reading your own MRI report is something that patients love to do, but I don't recommend it. The MRI report's really meant for physicians to read. When you read it, you may think that something terribly wrong is going on in your neck, when that just isn't the case at all. So save yourself some grief. Instead, what you should do are watch out for what I call red flags. These are symptoms that can signify something very dangerous is going on in your body. These are symptoms that include, in addition to your pain, fever, nausea, vomiting that can indicate an infection, severe neck stiffness or lock neck that can indicate also an infection or other serious problems, progressive numbness or weakness in your arms or legs, loss of balance and clumsiness of the hands and legs, and urinary and bowel incontinence. I highly recommend that you see a physician immediately if you have any of these symptoms. Okay, let's start with one of the most common conditions that can affect the cervical spine, which is a cervical disc herniation. When a cervical disc herniation occurs, the disc ruptures, extrudes a piece of itself into the spinal canal or the neural canal, and can pinch a nerve or the spinal cord. This can create a knife-like pain from your neck down to your arm, and in addition may result in numbness or weakness. In combination, these symptoms are known as what's called radiculopathy. The treatment varies depending on the severity of the disc herniation and can range from things like physical therapy and injections all the way up to surgical decompression. So in this cartoon we have 2 cross sections of the cervical spine, and you can see the intervertebral disc and the nerve root which is adjacent to it. And as the disc ruptures, you can see that it actually compresses on that nerve root, causes a severe amount of inflammation that spreads down the nerve root, and that's what results in the pain and weakness. The symptoms manifest as a knife-like pain that travels from your neck down your arm. The nerve compression can also result in numbness and weakness of your arm. The next condition we're going to discuss is probably one of the most important, which is cervical stenosis and cervical myelopathy. When cervical stenosis occurs, it basically means that degeneration is causing tissue to build up inside the spinal canal, and that pinches the spinal cord. The spinal cord is a very eloquent structure containing millions of neurons that help control your body, and it does not like to be pinched. When it becomes pinched, it results in a condition known as cervical myelopathy. Cervical myelopathy primarily presents with numbness and weakness of the upper extremities and lower extremities, changes in your balance, difficulty with walking, increased clumsiness of the hands and legs, and even incontinence. What's tricky about cervical myelopathy is that it can be painless. These symptoms can sneak up on you. You may think you're just getting old. If you have any of these symptoms, you need to seek surgical attention right away. So let's go back to the cross sections of the cervical spine. Here we can see the spinal cord. As you experience degeneration, plaque, bone spurs, ruptured discs can impinge upon the spinal cord and take up space in the spinal canal. When the spinal cord becomes impinged, it can destroy the neurons, resulting in cell death, causing a condition known as myelomalacia. Cervical myelopathy presents with upper and lower extremity numbness and weakness. Your legs become clumsy, uncoordinated, your hands become clumsy, you may have difficulty buttoning your shirt. Walking upright can become difficult. Again, if you have these symptoms, you need to seek medical attention. Another very common condition that I see in my spine clinic is soft tissue injury, which is colloquially known as whiplash. Whiplash is very common after motor vehicle collisions where your neck undergoes a sudden acceleration and then deceleration, and this can injure the complex series of ligaments and muscles around your neck. Usually it does not require surgery, it's treated with physical therapy. So here you can see some of the ligaments around the bones of the spine. There are the joint capsules around the facet joints, and then there are other ligaments that actually join the vertebrae together. Your skull is like a big weight, and so when you have a sudden acceleration and deceleration, you can rupture some of these joint capsules and ligaments. It's very painful and can take a long time to heal. The next condition is unfortunately something that everyone is going to experience if they live long enough, which is cervical disc degeneration. As you get older, your discs, which are normally very plump and hydrated, start to become dried out and can shrink in size. This is a problem because the discs are what normally cushion the bones against one another, so when they get worn out, cracked up, and dry, the bones are allowed to come into contact with one another and they can wear and grind and ultimately become painful and arthritic. In addition to causing problems like cervical radiculopathy and cervical myelopathy, which we just discussed, cervical disc degeneration can result in neck pain and shoulder pain. Luckily, a huge area of orthopedics has been devoted to solving this problem. There are a lot of treatments available, so just discuss it with your physician. Here's what it looks like. You can see that a disc is breaking down. It allows the bones to slide forward and grind and come into contact with one another. The facet joints grind and become arthritic, so anytime you move your neck now, you can have neck or referred shoulder pain. The next condition is very common but usually under-recognized. It's called Atlanto-axial arthritis and is arthritis that occurs between the top two bones of the cervical spine, C1 and C2, otherwise known as the atlas and axis. Remember from the very beginning of this talk that the C1 and C2 joints are responsible for the majority of motion in your neck, so when they become arthritic, you have a lot of trouble turning your neck. Atlanto-axial arthritis is usually very painful, and treatment ranges from injection to surgical fixation. Here we can see the atlas or C1 grinding down on the axis of C2 and suddenly has trouble moving because the joints are no longer smooth. So in this video, I really wanted to give a summary of some of the common conditions that can occur in the cervical spine. In general, they are more serious than low back pain and low back problems. That's because the cervical spine contains the spinal cord. The treatments for these conditions are diverse and nuanced, so you really have to discuss with your physician what's right for you. It's not my intention for this video to give you the capacity to diagnose yourself, but hopefully it gives you an idea of when you should seek medical attention. If you like this video, you can subscribe. As time allows, I'll probably make more in the future.